They are part of our partnership, however. What we do at the First Nations Health Consortium is we promote Jordan's principle and enhance service coordination. So what does that have to do with university and whatever your studies may be? I will tell you absolutely everything. It has everything to do with what you're studying. And anytime that you have any interaction with Indigenous children, youth, and adults, Jordan's principle is often applicable in many senses. So Jordan's principle came about from a little boy named Jordan River Anderson, who was born in Norway House, Manitoba. When he was born with multiple complex medical needs. And because he had multiple complex medical needs, he was hospitalized for the first 2 years of his life. And so that meant that he stayed in the hospital in Winnipeg for the first 2 years. And when he was 2 years old, he was discharged from the hospital. However, it became a jurisdictional dispute between the governments, the provincial and the federal. Neither government could decide who it was that was going to be responsible for his medical bills. So Jordan River Anderson remained in the hospital until he was 5, which is when he passed away. And our motto at the First Nations Health Consortium is no child forgotten. We don't want this to happen to another child. I mean, the reason that he lived every day of his life in this hospital was because the governments couldn't come to a decision as who was going to pay for his medical bill. And all the family was seeking was home care supports. And because the governments couldn't decide who was going to take care of that medical bill, he remained in the hospital for the entirety of his life. So First Nations Health Consortium, with Jordan's principle, when it was rolled out, the government had actually said, the federal government had stated that there are no Jordan's principle cases in Canada. The First Nations tribal chiefs and the Assembly of Chiefs came together and said, absolutely, there are Jordan's principle cases throughout Canada. Many of our communities live in third world situations. So the government wasn't sure, the federal government wasn't sure on how to roll out Jordan's principle. So what they did is they put out a proposal for all the provinces and territories throughout the country. So it's a nationwide initiative. And they basically put out this proposal and said, may the best suitor win. So for the province of Alberta, we had 4 health directors that came together from Big Stone Cree Nation, Muscogee Cree Nation, Cascana Cree Nation, and Siksika. These 4 health directors came together, put a proposal in for the province of Alberta, and won it. So this is how the First Nations Health Consortium came to be. So what we do is we do enhanced service coordination. What does that mean? That means that we work alongside with any families that are experiencing gaps in services, whether it is educational, social, or medical. And Jordan's principle applies to children and families that are from, I like to say 0 to 18. We are instructed to say newborn to 18, but I tell you, I say 0 to 18 because we have many youth that become pregnant and are needing parenting skills, that sort of thing. So I say 0 to 18 because if you are with a child and are needing some supports, then that becomes a Jordan's principle case as well. So that's how the First Nations Health Consortium came to be. We work very closely alongside with the McGill University. McGill University has our qualitative research data analysis. What does that mean? That means that there are numbers of people. They keep our demographics on the types of files that we see and that we receive and that we support throughout the year, and we have to hand that back to the federal government. This is important because, and this is a new piece that I'm sharing with the presentation, this is a very important piece because here in Alberta we are taking the lead for the country. So we are the first and only province that has an MOU, a Memorandum of Understanding, that was set in place on November 18th of 2018. I'm fortunate enough that I can say that I was part of that. And what that means is that those treaty rights that have been promised and not fulfilled have been reinstated through Jordan's principle. I'm trying to do that. So we here in Alberta are the only province in the country that have a memorandum of understanding. we have all of the other provinces asking, how did you do that? So we also are the only province in the country that has taken on SARF. So what is SARF? SARF is the resource funding that is supports and access to resource funding for the province. So let's say, for example, if you have a child that is been denied non-insured health benefits for a prescription or for medical equipment, and when you are approved to Jordan's principle, it is quite time extensive. So what does that mean? So that means that if you're approved and you're approved for a child for a wheelchair, you might not necessarily get that because the government is so backlogged, and it would take anywhere from 3 months to a year for them to fulfill that promise. But we at the First Nations Health Consortium have taken on SARF, and so what that means is we can expedite your services from 3 to 5 days, which is a vast difference to 3 months to a year. Okay, so what is our motto? Our motto is our children are our passion. Jordan's principle in that service coordination is the link between the child, the needed programs, service supplies, equipment, and support. So what does that mean, and what does that have to do with university or what you might be studying? If you are an individual that is younger than 18 years old and you are experiencing gaps in services, let's say you're needing some supports for your textbooks or you're needing a tutor, or if you have a child that is needing a tutor that's in school and is needing supports, then that is a Jordan's principle case. What we would do is we would assist the families with those services. So how do you access us? You would call the 1-800 number. Our number is 844-558-8748. I do have some brochures on the back table just behind this group here, where the red lanyards are there. Please feel free to help yourself after this presentation. There's some brochures there that you can take with you and give to your friends or utilize for yourself. Because you would call the 1-800 number, ask to speak to an access worker. When you talk to the access worker will take your basic demographics. What does that mean? That means they'll ask your name, phone number, and what's going on. Once your basic demographics have been gathered, then they will assign you to a regional service coordinator. And here in Southern Alberta, we're very fortunate to say that we've just hired an access worker for your own area. She is positioned in Gaina, or Kaina, which is how they pronounce it now, in modern Blackfoot. And we also have a regional service coordinator here in the south. So you can call that 1-800 number and ask to speak with Beatrice Little Mustache, who is also positioned in Gaina, but we do service Lethbridge as well. When you call and you ask for and you create a file, you are not necessarily guaranteed that you're going to have an access worker or a regional service coordinator from your area. We are province-wide. We do service both on and off the nation. So, and we do have, currently we have 17 positions where we have regional service coordinators that are working with families throughout the province. If you were a child that was in care or part of the 60 scoop and you don't have your registration papers, you give our office a call. When you speak to the access worker, let the access worker know exactly what you've shared with me. That this individual has been in care, is entitled to Indian status, but has not yet been registered. And then what will happen is they will create a file for you and help you access the information and even help you with the application process of getting the number and registering your child. When you have a parent that has a child that has had a prescription and they've had to pay out of pocket, we do have a reimbursement. So through Jordan's principle, and if you anything that basically how it works for Jordan's principle is anything that is not covered through your non-insured health benefits is a Jordan's principle case, providing that you are from 0 to 18. Great. And I say 0 to 18 because, again, if you have someone that is with a child, then we like to make sure that that child is cared for. With Jordan's principle, we do go back as far as 2007. So if you do the math, 28, 29 years old, we do go back. But I'm just going to be very blunt and very honest about that because that's an important piece. I have yet to see one file or any files approved where it's an adult with without a child. If there's a child attached to that adult, then we were able to support that family. So I'll give you an example. For example, I had when I was working as a regional service coordinator, I did have a client that was 26 years old. He had been diagnosed with FASD, has a couple of children, wanted to take an employment training program and return to school. He was not successful in getting funding from his band or another agency. He came to Jordan's principal, and Jordan's principal was able to provide childcare for his children and support him to get into the employment program and some training dollars. So those are very far and few between. What happens is when you apply for Jordan's principal and you have that type of a scenario, is that you have to fill out questions that are called the substantive quality questions, which are on the government website. You would just type in substantive quality questions, and that'll come up, and then you have to answer those questions. So what I tell people is when you answer these questions or when you're reading these questions, they're very federal, provincial, government related, not kind, they're very invasive. I'm trying to be So I in return really tell people that you need to give them that back in return. So you need to be blunt, and you need to be honest. And this, when I explain the substantive quality questions to people, what I do is I explain that some of the questions are rather invasive, is what I'm trying to say. And so this is an opportunity for you to use this as your platform to really tell your story and flesh out what's going on, right? I mean, so I'll give you a scenario. I had a client where a grandmother was taking care of the grandchild. Grandchild has cerebral palsy, also has other multiple complex medical needs. The child is tubally fed, and grandmother lives on social assistance or old age pension, whatever it may be. And she wasn't able to pay for his medical equipment. And I don't know how many people are aware of this. This isn't known knowledge, but if you are a First Nations and you have Indian status, you're entitled to 5 pieces of equipment if you live on the reserve once every 5 years. So this child was diagnosed with cerebral palsy when he was 3 years old. When he was 7.5, obviously that wheelchair had no utility, neither did the accessories, but because he had 2 accessories put onto the wheelchair, he had maximized his allotment, right? So they came to Jordan's principal and he was approved for a new wheelchair. He wouldn't have been, we had to wait for a denial order for the non-insured health benefits because he wasn't yet the 5 years hadn't surpassed. But through Jordan's principal, we were able to get him a new wheelchair and the accessories that went with it. And it doesn't come with limitations, like you can't have the handle guardrails and the foot rests to put his feet on, and then you've maxed out, right? Through Jordan's principal, we try to take care of the child and the child's needs, right? So the First Nations Health Consortium, our objective is to identify needs for the children and youth. And we are service coordination. So what does that mean? So what that means is through Jordan's principle, we do not duplicate services. If there is a service already readily available in your community, so let's say for example, someone is in need for some mental health. I use mental health, it's always one of my favorite. That's not just because I'm a clinician. So if somebody wanted to go for counseling, and it's denied to non-insured health benefits, then Jordan's principal will take care of that. But if that service is provided in your community through your band, and they have a long wait list, that's not to say that you have to sit and be at the sitting duck and wait for that wait list. So, if that service is not what you would need, supporting documents indicating that, yes, we do have a service that is available in our community. However, there is a max and I put on the wait list. And if this is an emergency situation or something that needs to be dealt with immediately, then what you can do is you can utilize other services outside of your community. You would just need that supporting document saying that I am on a wait list, however, this is important enough that I need to go outside of that means. Is that clear? Okay. So the First Nations Health Consortium, Again, we have access workers. We have 2 in Calgary, and 1 in Gayna, Edmonton, Musqueam, one in Grand Prairie. And the access workers, again, what they do is they take your basic demographics, so they'll do your intake for you, get a synopsis of what's going on. And then we have Jordan's Principal Regional Service Coordinators. These are the important people that we will be working with. Well, they're all important, but the Enhanced Service Coordinator will actually walk alongside with you until your needs are met. The difference, there's a lot of confusion in the public. So Alberta Health Services does have Jordan's Principal workers. Alberta Health Services has Jordan's Principal organization within their organization. However, what that looks like for AHS is when you call their number, they will give you a rundown on what you need and then leave it to your own devices. When you come to the First Nations Health Consortium, you will be assigned a regional service coordinator who will walk with you. What does that mean? That means it's enhanced service coordination. If you have applications like registration, or if you're needing to get a hold of other, like an OT, occupational therapist, physiotherapist, that sort of thing, and not all people are able to articulate what it is that their needs are, your regional service coordinator will walk alongside with you and guide you and do that with you. So you're not left on your own. A lot of people don't know. They think that people have this misconception that your medical is covered. No, it is not. You have very basic medical. In fact, the reality for First Nations people is that if you have an Indian status card, you will have the very basics of your medical. You don't have the same rights and privilege as a regular citizen in Canada or even an immigrant. Your dental falls for the same. You're allowed to have 1 cleaning. If you're an adult, you're allowed to have 1 cleaning a year, and sometimes that's half a cleaning. Okay, enhanced service coordination key goals. Our goal is to identify children with needs, to facilitate early intervention. What does that mean? That means if you have a child that you see is behaving irregularly, or you're seeing things that are noticed that are not normal, like let's say, for example, we have a child that enters into the schools and has a bit of a speech impediment, or has speech impairment, or is maybe suspect of FASD, FAE, ADHD, what have you, or you're thinking he's needing a psych assessment, those are all covered through Jordan's Principal. And what we do is we try to help facilitate that and get that put into place so that the families can help address the needs of their children. So we develop integrated care plans. We work alongside with the families and connect the child and the family to needed services. Once again, we don't duplicate services. So if there's a service available within your community, then what we will do is we will connect that person and that family with that service. However, if there is a wait list or something else that's going on, then what we will do is we will find an alternate route. We try to remove the stress of navigating service systems. What does that mean? It means that not everybody knows how to articulate or navigate their way through applications and application forms. I mean, even us as professionals, we look at application forms and we're like, really? So what we do is we try to assist some of the families and work with them to get their paper processes done and put in place. And we support the families as they manage their needs. This includes status and non-status. And I just wanted to speak to that for a second. If you have a child that is, for example, I adopted a little boy, a little English boy, and if you have a child that is living with you on the nation and is not First Nations, that child, and you have somebody in the governing bodies like a chief or council that would say, yes, this child resides on our lands, then that child is covered to Jordan's Principal, whether or not they are registered First Nations or even First Nations. So, yeah. If you have a child that ordinarily lives on a reserve but has had to relocate because of medical reasons or education or what have you, or go outside and get services that way, that is also a Jordan's Principal case. Finally what happens is, and this is changing, I'm going to take this part out of the PowerPoint, is once we have a file compiled and we've collected all the supporting documentation for families and the referrals, what we would do is we would send it up to a focal point for approval. The focal points will either approve or deny. And if it's a more complex case, then it would go up to national. So maybe we'd go back to Ottawa All right? So there are two types of requests for Jordan's Principle. You can do individual requests. Individual requests are anything between, social, education, and medical. And when you talk to, so you would call the access worker at the 844-558-8748 number. They would ask you for your basic demographics. One thing that I would really encourage people, if you have a treaty number, you need to have that available, and you need to be able to sign a consent form. So if you're looking for certain services, we'll need to know who the doctors are, that sort of, and who the different organizations that are working with the family. They need to be, what we do is we form a team and then we work together so that we're not duplicating services. We have to prove that what we're doing is actually for the benefit of the child. So we do ask that when you do a referral, that you sign off on a consent form saying that we can work alongside with these families. When the file is composed, it's handed off to the regional service coordinator, and then it goes from there. The other type of referral or request that can be made is a group request. So group requests are interesting. There's no limit to the number of group requests each community or tribal council or Indigenous or non-Indigenous can submit. And the First Nations has assisted First Nations with applications for group requests. And some of the group requests that we have seen are for youth empowerment programs. One of the ones that I did with the regional service coordinator is that they had one of the communities here in the South, First Nations community, the health center had noticed that the neighboring community had a health and wellness truck, which meant that they were providing foods for, they had a truck that would come in and provide fresh vegetables and food, and where they were able to buy these products off of this truck. Well, this First Nations community wanted to have the same thing. They said, well, we have a problem. If this community has it and we don't have it, so they put in a group proposal to Jordan's Principle asking for a fruit and vegetable truck to come into the community because they have a transportation issue. And how they were able to get that passed is that the nurses in the community had composed a group proposal saying that we want this fruit and vegetable truck. With this fruit and vegetable truck, they were going to provide parenting classes where they would teach the families how to prepare these foods for their children, and then the children were involved. So there was the cooking classes, and then they had childcare for the children where they were actually getting lessons on different, whatever they might have been. And then transportation. Part of that was there was an incentive package that if a parent was to participate in these classes throughout the week, at the end of the week, then they would get a food voucher so they could purchase items off of the truck. So that's just one example. And that group proposal was for $385,000 and was approved for the year. So we've had other group proposals where you've had institutions or schools here in the South where they had resources, federal funds for their libraries. However, they didn't have the monies, or they wanted to update the resources that are in their libraries, and they didn't have the funds to do so. So they put in a group proposal and asked for that, and it was approved, and they were able to get 3 staff to come on board. So the First Nations Health Consortium is a resource that's available for First Nations and Inuit to utilize Jordan's Principle. So, and that's an important piece. So Jordan's Principle applies to First Nations and Inuit children. It does not include the Métis. That's currently in the courts and being re-looked at. So that's one of the questions that we get asked frequently. It was just something that was not brought up in the courts, and what is being revisited now. So I don't have an answer as to why. So examples of common group requests are professional assessments. So what does that mean? So some of the schools, like for example, one of our neighboring communities here in the South had a large body of Indigenous students where they were wanting to do psych ed assessments. Because there was 6 to 12 students that they were wanting to do the psych ed assessment, they weren't able to get them on the list for the psych ed assessments for the school year. So what they did is they came to Jordan's Principle to try and expedite those services, and then had another psychologist come in and do those assessments, although they had already received funds through the federal government. The type of service coordination requests that we often see are allied health therapy, occupational therapy, physiotherapy, speech and language pathology, GP specialist services, so nursing, podiatrist, orthopedist, audiology. Social supports, summer has just come and gone. What we often see in the summertime is if you have a child that has been diagnosed with ADHD, FASD, is that there's camps and programs that are set up outside communities or urban centers where children are able to go and learn different coping skills and coping mechanisms. And that is classified as a social support. So we were able to support some of these children and families to put them into these camps. Other types of social supports would be respite care. Now there are two types of respite care. There is medical respite care where you are automatically looked through your doctor and up with the proper channeling. You're covered for respite care for 20 hours, medical through your doctor. But I did have a child that was here in the south, that was in palliative care. So 20 hours really was not suffice, right? I mean, the parents had to rest at some point. So through Jordan's principle, we were able to top that up and give an additional 20 hours for medical respite care. But we also gave 20 hours for non-medical respite care. So what does that mean? That means that when mom was sleeping, we had a wake body in the house just in case baby slept. And yeah. Another social support would be hard goods. So what does that mean? So for example, we have children that are in education systems or in school and they might need, the teachers are needing, I can't remember the name of that machine that they have, where the teacher wears a mic and then the child wears a hearing aid and she's giving a lesson and that's provided. So that's a social support. And we provided that to some of the schools for children that are needing, or different educational tools. So educational supports would be teacher aids, tutoring, tuition, and educational materials. There are some, one of the ones that I would really like to, that I found fascinating was called Dragon Naturally Speaking, and it's a program for children that have trouble with literacy, and so they're able to speak into this mic and it will type up on the computer for them, and then they can read it back, because that really helps them with their literacy learning. Other supports that, or service coordination requests that we've seen are electronic hardware, electronic software, electronic accessories and peripherals. So what does that mean? So some schools have applied for their classes where they would like to have laptops or notepads provided for their students who are different university or literacy learning. Mobility equipment, furniture, prosthesis. So mobility equipment can be anywhere from a wheelchair to a lift in a person's washroom. So when it comes to that sort of thing, we have to prove it for the homeowner. And if it's a home combination, then you'll need approval through the band saying that yes, you're making contributions to this house, and they have to sign off on that. And then adaptive products like sensory items and adaptive other. What does that mean? So one of the schools here in the south, actually I'm going next month to have a look at this. They've created a sensory room for children, and I have yet to see it, but it was one of my files, and it was approved for $400,000.